For too long, Ontarians have been paying too much for generic drugs. In some cases, we're paying 5 times more than what people in some U.S. states pay. We are going to be bringing down the price of generic drugs, which will allow us to cover more drugs under the Ontario Drug Benefit Plan. It means that people who pay cash for their drugs will pay lower prices, and it cleans up a system in a pharmacy that has been open to abuse. And it also marks the beginning of a change in the role of pharmacists, where they'll be able to provide more services to people in their communities. Indeed, the dispensing fee per prescription will increase by up to $5 to protect access to pharmacies in rural and northern Ontario. In addition, we're creating a transition fund for all pharmacies to ensure that we can implement these changes as smoothly as possible.
Pharmacists, like any other health profession, need a viable place in which to work, economically viable. And I think a lot of pharmacies will still say that there's a large gap between the changes, the positive changes, which are in professional services, and the money that they've taken out of the system. So I don't think it's going to be easy for many pharmacists, and they're going to have to figure out how to adapt to the changes, especially in the transition.
With the problem that by doing this without any direct funding from the government to stores, the stores will be under enormous financial pressure and they will close down. And I'm talking here about independent stores, more than 1,500 stores.
In fact, every single dollar we save through these reforms will be reinvested back into our healthcare system. To that end, I'm very pleased to say that because of these reforms, we'll be able to strengthen and expand our successful Meds Check program, which pays pharmacists to help make sure patients are using prescriptions safely.
Well, the key here today is that we reinforce our support for the government's changes to the pricing of generic drugs. And now, there were a few small changes that were important, and it shows that the government was listening to some of the concerns that we raised. The price of generic drugs will fall for everybody, for the public program immediately, and so there will be more money left over to list more drugs, to apply to other parts of the healthcare system, and presumably to pay for professional services from pharmacists, because our members, in fact, like the changes. We polled our members, and some 91% of them were very supportive of the changes.
Seniors and baby boomers, and I'm one of them, know that we need to get the best possible value for the money we're spending on healthcare. So by lowering the price of generic drugs, it means that we're going to be able to improve our healthcare system and expand the drugs that are available under the Ontario Drug Benefit Plan. So I cannot tell you how pleased I have been with the advocacy of CARP. They have been tremendous advocates on behalf of their members, and I'm very, very grateful for that.